There's currently no vaccine to prevent COVID-19 to return to your shelter to protect yourself and life from the coronavirus.
In December 2019, there was a cluster of pneumonia cases in the city of Wuhan in China. Some of the early cases had reported visiting or working in a seafood and a live animal market in Wuhan. Investigation found that the disease was caused by a newly discovered coronavirus. The disease was subsequently named COVID-19. COVID-19 spread within China to the rest of the world. On 30 January of 2020, the World Health Organization WHO declared the outbreak a public health emergency of international concerns.
You know that the effect of COVID-19 is very to person, from person to person. In fact, some infected people they don't show any symptom. In general, people that infected by COVID-19 might have effect of short term, such as fever, cough, tiredness, shortness of breath, muscle or body ache, and headache, and other symptoms like new loss of taste or smell, sore throat, runny nose, nausea, vomiting, diarrhea, and other additional symptoms that are possible. Symptoms may appear like 2 days to 14 days after exposure to the virus. But children have similar but usually milder symptoms than adults. Other adults and people who several underlying medical conditions are at higher risk of more serious complications from COVID-19. But do you know that if you have the symptoms such as trouble breathing, persistent pain or pressure in your chest, and new confusion and inability to wake up from your sleep, you are really need to get immediate medical attention because it is the sign of serious symptom of COVID-19.
The final is the doctors, the nurses, the police, and the army of soldiers. The struggle that they face is they work in the long hours. They cannot see their family because they work outside. And for the doctors and the nurses, they might get infected with the COVID-19 virus for themselves because they are treating the COVID-19 patients, and the most increasing cases for the doctors and the nurses and all the frontline workers is their mental health are in very bad condition.
COVID-19 affect not only the students, but it also affect the teacher, parents, and across the world. The United Nations Education, Science and Culture Organization, UNESCO, reported that our 1.5 billion students in 195 countries are out of the school in the world due to the schools closes. As a COVID-19 effect all over the education system, examination and evaluation starting a new semester of the term may be extended to the next year. The COVID-19 crisis social inequity. The school students are attending school to adopt online learning. Students from the more advantageous parents attended school with the better digital instruction, and the teacher might have the higher level of digital technology skill. Some schools cannot be well equipped in digital technology and the education sources, but at the same time, some of the students are attending classes with a low ICT certification and education sources. Schools also struggling in rural area, lack of appropriation digital instruction required to the delivery student at the remote. Also, there is a significant difference between private and public school in the technology and education sources. In the most of private schools are more effective than a public school. Students have not equal access to the digital technology and education material. The students find that during school closes, the anxiety, depression, concentration disorder, and the stress are high amount of to the student.
As the precaution of the COVID-19, we should avoid 3C and practice 3W as the new norm of workplace. Avoid the 3C. First, avoid the crowded places such as all assembly for roll calls, eating room, and eating together in the canteen. Second, avoid confined spaces such as the pantries, prayer rooms, common dressing room, lift and locker room should be limited. And third is to avoid close conversations such as in meetings, at the counter, workstation should be avoided. We should practice 3W. First, wash. Practice a good hygiene by frequently washing our hands with soap and water or use hand sanitizer. The management should provide the hand sanitizer to every entrance and strategic location at the workplace. Second is wear. Individuals with symptoms such as cough or cold and workers who are frequently dealing with the public such as at the service counter must wear a face mask. Third is one. No handshaking policy at the workplace, but we still can greet people and say hello by placing our right hand on the left of our chest and bowing a little a sign of respect. And last, we should get our vaccine. The vaccine will reduce our risk of severe illness and death from the COVID-19. It's effective at preventing severe illness and death from the coronavirus. Get the vaccine booster as soon as it is recommended for you to increase your protection.
As we can see, COVID-19 has been the world's serious problems that we would never come in our lifetime. But when the COVID-19 had become a pandemic, it had changed the way people communicate in order to reduce and minimize the spread of the disease. They also gave a huge impact on all populations around the world, especially for our frontliners. A lot of difficulty against them that we can see. The number of cases will increase day by day. So let's take care of our own safety together by adhering to the SOP that has been set by the government.